What's the mental health impact of this cost of living crisis for most people here?
Well, the reality is that most people are actually very, very scared right now. And we know that the fear and that anxiety can plunge people into mental health crisis. It worsens, certainly for people who have an existing mental health problem. You know, their condition worsens whenever there's fear. And financial pressure is one of the things that can plunge people actually into suicidal crisis. So there's strong evidence that during the last recession that the austerity measures that were put in place led to an increase in the numbers of suicides there. And there's no other explanation for that increase. And we can see that very clearly in countries where there's no strong financial protections for people who are vulnerable. So, I mean, but the suicides are the tip of the iceberg there. There's so much suffering right now in our communities because people are very, very scared about how they're going to feed their families and heat their homes over the next few weeks and months. And the types of actions... Yeah, sorry.
Do you think the politicians get it?
Well, I mean, it's difficult to say whether or not they get it, but it's notable that this is the first time I've had an opportunity to talk about this issue and the impact on mental health on the radio. The discussions have been around other aspects, other aspects of political life that impact on things here, but the mental health impact is absolutely huge, and we are seeing a decline in young people's mental health that hasn't recovered since the end of the pandemic. So I'm very, very concerned about that as well. What I can say is that we need to use this time now. If we have caretaker ministers in place, they need to be devoting all of their efforts right now to addressing the cost of living crisis and to provide specific support for people whose mental health is impacted by the situation that we're in. So, I mean, what we need to do now is to look at those death charities and get them funded and make sure that people get the support that they need over the next few months. So it's about dealing with the situation as we have it right now and doing whatever we can to ease the burden on people's mental health and make sure that services are equipped to meet the demand.